Hey guys, today we're going to talk about a very serious condition and a cure from that. Vaginismus, also known as vaginismus, is characterized by involuntary muscle spasms in the muscles surrounding the vagina. This spasm can cause pain, discomfort, and difficulty with vaginal penetration, including during sexual intercourse, or the insertion of the tampons. Women don't cause vaginismus on purpose or intentionally. Vaginismus has a variety of causes, which are usually in response to a combination of physical and emotional factors. It can be frustrating and distressing for the woman and her partner to figure out what's going on. And many women, unfortunately, feel ashamed of not being able to have an intercourse and hide their pain. A lot of my female friends and customers at the adult stores experience this problem because of a variety of reasons. However, there is something you can do to fix it and start enjoying sex fully. So today we are gonna talk about dilators from Femintimate in particular. Intimrelax has been specifically designed to enable you to perform exercise and to progressively dilate your vaginal canal comfortably and get your pussy ready for an action. A vaginal dilator helps to stretch the tissues, train people to relax or straighten their pelvic floor muscles, and today we'll discuss this condition, its causes, and how to perform this therapy with this beautiful kid from Femintimate. Guys, according to YouTube policy, 18+ content can be promoted or monetized. I'm doing this for free just to raise the level of sexual education, because someone has to talk about those topics loudly. So please like and subscribe, it's not that hard and I'll appreciate it a lot. So let's first break down the possible causes. The exact cause of vaginismus is not always clear. It's a multifactorial condition with both physical and physiological components. So some possible contributing factors may include negative emotions like fear or anxiety related to sex, trauma or culture and religion. When you feel ashamed of having sex because of your religious upbringing, it can be definitely one of the reasons, and many women are dealing with this on subconscious level without even knowing. And for women, again, the way we function down there has a lot to do with our mental health and our attitudes. And another possible cause is previous painful experiences. Traumatic or painful experiences like sexual abuse, childbirth trauma, or past genital surgery can lead to muscle spasms. And of course, relationship issues, communication problems, lack of trust, and unresolved conflicts can make vaginismus only worse. And of course, physical factors, infections, hormonal imbalances, dry vaginal tissues, or anatomical abnormalities, surgeries, etc. And the symptoms are not so pretty. Itching or burning during sex. The penis is difficult to insert and it's painful and uncomfortable. Sexual discomfort or pain after childbirth, urinary infections, sexual transmitted disease, menopause, etc. Continuous sexual pain without apparent cause, trouble inserting tampons or having a doctor exam, muscle spasms in other parts of the body, avoidance of sex due to pain and failure. So now you know the possible causes and how it actually feels. So now let's talk about the solution. So we already know that vaginal dilator is a tube-shaped device that is used to stretch your vagina. Of course, it won't resolve psychological problems you are dealing with, but at very least, it can help you to train to relax your pelvic floor muscles. Dilators come in kits with different sizes and shapes, and this one is not an exception. What I love in particular about this option is that it has a wavy shaft for additional stimulation of the Gspot and vaginal walls. It also comes with finger dimple handle for easy removal and insertion, and also a smooth tip for Gspot stimulation. It's body safe, it's made of silicone, and it's water resistant. I really love the material it's made of and its nice casing, which makes it so convenient to use. It's made of super soft, superior medical grade silicone that is phthalate free, making it a perfect fit for people with a sensitive skin or allergies. So it's made of medical grade silicone again, so you don't need to worry about pH of your vagina. Plus, it comes with a casing that protects dust and bacteria from collecting and makes it a travel-friendly product. I like the design of most products from Adrenaline and Femintimate. They are all very stylish and manufacturer is very thoughtful about the details. Using the smallest dilator in your kit, you will slowly increase the size of the dilator as you feel more comfortable. You can use wider dilators as your vaginal tissues become more flexible. And this particular kit has very nice pink color, Barbie style pink. So by doing small daily exercises, you lose the fear of penetration. In this device, there are 3 elements with an ergonomic shape and different sizes to solve this disorder that causes harm to sexuality and your mental health. It's best to use Intimrelax with a water-based lubricant to ease exercises and lubricate and moisture your vagina. The Femintimate Intimrelax training system starts with a very small pink silicone dilator with the insertable length just 2.5 inches. The second dilator has 3.75 inches of insertable length, and the third and the largest in this set has an insertable length of 4.8 inches. So the vaginal dilators come in small, medium, and large size to treat vaginal contraction all in one kit. In some cases, people have even found that they could use the handle as a Gspot stimulator. It works great for trans women as well who had the bottom surgery, and using Femintimate Intimrelax with a water-based lubricant is definitely a good idea to make the exercises easier while you're lubricating and hydrating the mucosa. So silicone also makes them easy to clean with a soapy water or antibacterial toy cleaner. So now let's talk about how do we actually use it. So using a vaginal dilator is very simple. You shouldn't feel any pain if you do it slowly and gently. You should be done in 10 to 15 minutes. Start with the smallest dilator that you have. Use a large size if you don't feel any pressure when you insert the dilator. Apply a water-based lubricant to the dilator and to the vaginal opening. This will help the dilator slide into your vagina easily. Then gently insert the round end of the dilator into your vagina. Put it straight towards your spine or a slight downward angle like a tampon. Insert the dilator slowly until you feel slight discomfort, then stop. Feeling pain? Stop. Do a set of Kegel exercises. You'll be able to insert the dilator a little further if you relax your pelvic floor muscles. We broke down how to do Kegel exercises in another video, please check it out. When your pelvic floor muscles contract, your vagina narrows, but when they relax, it opens up. So if you relax your muscles, you may be able to insert the dilator further. Try taking some deep breath after doing Kegel exercises if you still can't insert the dilator. Try inserting the dilator a little further after relaxing your pelvic floor muscles. So for 5 to 10 minutes, gently move the dilator inside your vagina. If you need more lubricant, add more. It's never too much lube. Push the dilator in and out gently. You will feel your vagina stretch. Make wide circles with the dilator at the back, middle, and the opening of your vagina. Vaginal whites get stretched this way. It's helpful to work with more than one size dilator. So you can use a bigger dilator at the opening and a smaller dilator deeper inside your vagina until you can use the next size dilator fully. The objective of the Intimrelax is to relax the vaginal area as well as overcoming discomfort caused by vaginitis. When you can insert the smallest dilator comfortably without any discomfort as part of the exercise, you should then continue with the bigger dilator. Take the dilator out of your vagina. After using your vaginal dilator, wash your product with hot, soapy water. Make sure it's dry with a clean towel or paper towel. So store it in a cotton bag, and Femintimate provides this bag in every package. And after you use your dilator, you may want to urinate if you get urinary tract infections. Increasing your dilator size. You want to slowly increase the size of your vaginal dilators during your vaginal dilator therapy. So you should start using next size once you can insert one size of dilator completely into your vagina without any discomfort. So ideally, of course, you want to insert the biggest one. And you will be more comfortable during pelvic exams, vaginal sex, or both if you do end up increasing the size. So dilator therapy should be done 3 to 4 times per week, but not 2 or more days in a row. So let your pussy relax a little bit. So when you are not using your vaginal dilator, do Kegel exercises. If you forget, start again as soon as possible. Coming up with the plan or routine is a good idea, so make it a part of your daily routine and be happy having a lot of sex from now on. To sum up, with Intimrelax you can do exercises and gradually dilate your vagina. It's made up of 3 slim silicone elements with perfectly ergonomic shapes and sizes to fix this problem. Don't ever be ashamed of this and start fixing the problem. Nothing feels better than a good sex. Comment below if you have ever experienced muscle spasms down there, and if you did, I highly advise you to check out this kit and get your pussy ready for an action. And I'll see you next time in bed with Kate.